Okay, hello everyone. I think I see the participants entering in here. I'll give it another minute. I think that's all of us. Okay, so welcome to Doctors with Transplants. I am Gianna Paniagua. I'm the moderator today, and I am a two-time heart transplant recipient. I'm 31, and I received my first transplant in 1991 at Columbia, the second at Vanderbilt in 2021, both hearts. And I am also a Columbia student working towards working in medical care and studying narrative medicine as well as graphic medicine. So I'd like to introduce our speakers today. We are down one speaker. Dr. Catherine Smith could not make it today, but we have other great speakers here for you. So we have Dr. Manu Varma, we have Dr. Ken Sutha, and we have Dr. Julie Bon. And so I will get started with the questions. If Melissa, you'd like to drop those in the chat. I don't see any yet, but we could just start with the question that we've kind of talked about before. And so I think that we'd like to start by talking about what are some things that working in medical care you've learned or you've observed, whether in your own practice or maybe in other departments, that you wish people on the patient side knew. Things that you think maybe it would be really great if more patients knew about this, or if this was kind of given to patients right from the start and given to caregivers as well.
All right. Yeah. And I wanted to make sure we all kind of introduce our stories a little bit too, so everyone knows where we're coming from. And we'll definitely answer those questions. So as Gianna said, I'm Julie Bon. I am a liver transplant recipient, which I always say everyone's transplant journey is unique. And mine definitely was. I was totally healthy until 12 years of age and then had acute liver failure leading to my liver transplant at Cincinnati Children's Hospital. I was very sick very fast, only on the list for a couple days, and then miraculously got a liver and have overall done very well. So I'm now 22 years post-transplant. Did have some complications that first year in and out of the hospital. And now I am a pediatric gastroenterologist and hepatologist at Cincinnati Children's. So I've come full circle, and it's very, very cool to be able to work alongside my previous hepatologist. He is now my colleague and big mentor and inspiration, but really be able to come full circle in my own city here in Cincinnati.
Hi, I'm Ken Sutha. I'm a pediatric nephrologist at Stanford Children's Health. I also have kidney disease myself and have had 2 kidney transplants. I was diagnosed when I was first about 10 years old with FSGS. At first, they treated it like nephrotic syndrome, but I didn't respond to the normal course of steroids that are usually used to treat that. And so a biopsy was performed and found that I had FSGS. They were able to put me on some medications that could slow the progression of my disease, but not completely stop it. So by the time I was graduating from college, I knew I'd need a transplant or dialysis to survive. Thankfully, my dad was a match and was able to donate a kidney to me in my second year of medical school. With the transplant, I was able to continue on and finish my major board exam with the rest of my class, volunteered with a camp for kids with different kinds of transplants, and went and competed at the transplant games. Unfortunately, as many of you all know, transplant is a treatment and not a cure, and it comes with its own sets of ups and downs and side effects from the medications, and that was the case for me as well. I had a lot of issues with viral infections, particularly EBV and CMV, and because of that, my team had to reduce my immunosuppression, which unfortunately opened the door to rejection. After a couple of years of ping-ponging back and forth, I ultimately had to go back onto dialysis about 10 years after my first transplant. I was on dialysis for about 2 years before receiving my second transplant back in 2018, and this time from a deceased donor. And thankfully, I've been doing pretty well. There's still some ups and downs, of course, that come with it, but I'm happy to be here to join you all for this session.
All right, just 1 second. Okay. Hi, I'm Manu Varma. For introduction, my story is actually a lot like Ken's, that I was healthy until I was 10. I was identified to have renal dysplasia, just kidney was not formed right. It showed up with a kidney infection, which was not usual at that time. Went along with medications for several years until my first year of college, when kidney failure progressed. It was all, again, clear I'd need dialysis or a transplant to survive. I also got a living donor kidney from my dad in January of 2000. So I've crossed 23 years with the same kidney, which has been very fortunate. Certainly a lot has changed in transplant medicine, and it's been an accompaniment throughout my whole life and time. So yes, I had acute rejection episodes, had a chronic rejection diagnosis, had CMV, did not have EBV symptomatically, did have, so essentially the typical ups and downs medically, but overall I have to say I've done well. Professionally, this was not good timing. So after college, I spent several years sort of reliving college and figuring out what I wanted to do next. I eventually started medical school in 2010, took a little bit of a longer road in residency training and other things throughout that. And now I'm essentially finishing up formal training. Right now, I'm in a position that's half fellow, half attending, specifically in pediatric heart failure and transplant at Columbia. I think I'm the one who crossed organs between what I had transplanted and what I do professionally. And then I will be going to NYU this summer to start as a transplant cardiologist.
Thank you guys for the intros. So sorry, I have COVID brain still. I forgot the intro. But I think I'll repeat the question. So what do you wish now that you understand what it's kind of like, and especially for those of you who kind of had the sudden onset of sickness, what do you wish that caregivers and patients kind of knew, either at the beginning or they had a better understanding of it, now that you know a bit more of the medical side of things, either in your own department or something else?
Yeah, I would say one thing that I've learned and experienced is just how unique everyone's transplant journey is. There are definitely some similarities, but I've definitely seen there's such a wide spectrum of, what brings people to transplant, what illness, what their course was. Has it something they were born with and they've been dealing with all their lives? Versus, you were totally healthy like me until 12 and then got super sick, super fast. And that is just a very different pre-transplant course. And you experience a lot of different emotions, struggles that are sometimes it's hard to compare and contrast. But then really at each stage of the journey, just right around transplant, have you been called into transplant multiple times and it hasn't gone through? Or, that first time it worked great, and then, complications in the hospital during that transplant stay, versus again, the long-term, I say, transplant journey of, what kind of complications do you deal with afterwards, whether it's a few months, a few years, et cetera. And even the big question of, retransplant. So that's something that I've definitely seen, we all are very connected to our own journeys, as we should be. But seeing how different the experiences are is something I've definitely seen more so as a provider side.
Yeah, especially coming from being 12 and going through this versus being an adult. Manu, would you like to add?
Yeah, I mean, mostly I have the same exact thing as Julie said. What I will say is that a lot of this also wasn't even clear. So I had 10 years between my transplant and starting medical school, and was pretty involved in the transplant community in the more analog versions of things like this. We did not have Zoom at the time, but it's a much wider spectrum of people you meet, and patients and families and experiences on the physician side. the ones who were able to come to transplant families conferences, were able to go to the summer camps, volunteers with the EOPs, all things I did and all stories I heard are still very different than the whole population out there that could need or benefit from transplant and has very different life experiences, many oftentimes more disadvantaged than ours, which is not surprising, but striking. And ultimately, same thing, that there's a lot of patients you see who even being very involved in the transplant community pre-medical school didn't see it the same way as I do see it providing medical care.
Yeah, I would add, echoing both what Julie and Manu said, there's just so much individual experience that happens. And as a patient, there's often times when I want an answer right now, but look on the provider side, as a physician, I know how much uncertainty there sometimes can be, and it takes some time for us to figure these things out and figure what the right approach is for each individual patient. And exactly as Manu mentioned, there are all these other factors that also influence our courses as transplant patients that we have to consider as well.
Okay, so next question is, what are some of your biggest challenges working in this field when you have such a personal connection to transplant? Manu, you had mentioned that some things were striking. Can any of you elaborate on some of those challenges?
I mean, I think actually one, and this may have been phrased differently in a different question I'm looking at, it's overall, and I've said this in our smaller chats, it's been wonderful. It's been a very unique way to make good or get through medical training in a medical career, which are not pleasant environments a lot of the time, but I have a very good reason to do so. I'd say the biggest challenge or hardest part is the people for whom the promise of transplant doesn't hold up, the patients who do clearly a lot worse than the three of us have done. I think there's no denying all of us have had patients who've done terribly compared to the very good outcomes overall we've enjoyed. And that's, you could call it survivor's guilt, you call it very humbling, to say the least, that I think we have benefited so tremendously from transplant, and sometimes it doesn't go well and doesn't work out. I think related to that, and this came up as a bias sort of earlier in my cardiology training, that I'm like, well, why isn't this kid a transplant candidate? Why don't we do it? And it was pointed, I was like, yeah, but you see transplant as something that works because that's been your life experience, and you may not have seen as many that crashed and burned. So maybe the fact that we're holding back on that comes from in fairness, that could come from a more pessimistic experience where they've seen all the ones that don't work and don't see people out there living well. But I'd say, if anything, it's a bias towards transplant working. It's been very empowering and engaging on one hand, but it is a bias.
Okay.
Yeah, I would definitely agree with what Manu said. The bias of not generalizing what my experiences have been to what my patients are going to experience. And exactly as we said in that first question, there's just so many other variables and privileges that we enjoy that might impact that. But the flip side is that there's so much joy in seeing the great things that our patients are able to do, and when things go well. And overwhelmingly, that's the case.
So this is a question that I've actually heard people ask me as well, just being a patient and working in art. But I think this is especially important for those in your field. Now, especially with the amount of transplant patients who are growing up and wanting to work in transplant, maybe. So how do you balance taking care of yourselves and your health as a transplant recipient with the demands of a medical career and the medical training, especially the physical demands of long hours of residency and everything? I think my pediatric team had told me that there was an issue with stamina. And I that always had stuck with me. So how do you all balance these things?
Yeah, I mean, it's not easy sometimes, but I do always remind myself that, I can't take care of other people or patients if I don't take care of myself. And sometimes I've even been told by my colleagues that I do a better job than they feel like they do for themselves. So I think it definitely is always a balance, but really just trying to prioritize making sure you're getting enough sleep, taking your medications. You know, I did have a little bit of a hiccup during medical school one time that I had to get admitted for a liver biopsy. And luckily all of my teachers, professors, rotation directors were very understanding. There was not any like reasons to hold me back. I did do some extra, academic work. So, but I'd say overall, it is just important to figure out work in the lifestyle, always have that water bottle with you, make sure your medications are in your backpack and at home, making sure that, telling your team, I have to get labs, and people are usually, I never got any pushback if there was any issues.
Yeah, I think exactly as Julie mentioned, it's important to take care of yourself. I was actually just in the hospital like about 2 weeks ago, but I'm thankful that I have great colleagues that are understanding and have been able to give me grace when I need to take care of myself. They understand the importance. There are definitely some ups and downs and times when you may need to take some extra time. And I think learning to give ourselves the grace to step back a little bit and take longer if we need it, because I think that the strengths that we bring to the field of medicine from our lived experiences far outweigh the kinds of difficulties that, or like the prolonged path that we may need to take, or like bumps in the road that may happen. And that includes mental health as well. I think taking time to, this is something that I think is under-recognized both in transplant and in healthcare professionals, taking time to make sure that you are looking after your mental health, whether that be speaking with a therapist or medications, or just having a strong support system. Those are all very important things.
Okay. So some people have asked, what are some innovations that you're hopeful for with the future of transplant? Someone asked here some new immunosuppressants, bioengineering of organs, or other. I mean, I think we've been on the same cocktail medications for how many years now? So what are some things that you're excited about to see in the future?
I can take it since it may play into my future job. I think the big air project, at least, and this is speaking a little more to heart, which I can speak to better professionally, is xenotransplant and the opportunity to have an unlimited donor supply. Certainly both the limits in donor supply are a huge problem, and then keeping it brief, the pig hearts that have worked more recently were genetically engineered to make them work in a way that previous attempts, the turn of the millennium, did not. So that has more potential to go. In the more short or medium term, before that becomes a reality, I think, as Gianna, you said, we have the same tools as we've had for a couple of decades, but we're getting smarter and more deliberate about deploying them. I think we are personalizing immunosuppression and care a lot better than we did in eras past when everyone had the same protocol. Gotten a little more aware, again, speaking to heart in our field of, okay, you don't want to use sirolimus early on due to wound healing, but you may want to switch to it a little later to preserve long-term kidney health. So we're getting a little smarter about using the tools we do have, even in the short term, even day by day. A lot of the, a lot of the research and updates I've heard in the past year or two have been things like that, using our tools better. In the long term, I'm putting my money on the pigs, but I think I've been hearing that since before I had a transplant myself. So we'll see.
I would say I would add different, and one thing I have always dreamed of is being able to not take medications. So kind of the field of immune tolerance or immunosuppression withdrawal, which there's ongoing work, and whether we'll find specific candidates or whether there'll be new therapies that'll allow it for more people. And again, this is very different in different organs, because different organs have a lot of different immune properties and potentials. So I'm speaking a little bit more towards liver. But, we always think about long-term medications, what potential side effects. I can at least personally say, because I saw a question that, I'm only on tacrolimus, and have been for several years. And I honestly don't notice a whole lot of difference. Knock on wood, my kidneys are doing great. Sometimes that cold lingers a few more days, but lucky for me, I don't notice severe infections from being immunosuppressed with it. But again, everyone's experience is very unique.
Okay. So there is a question here for Dr. Bond, but I'm going to try to condense it into a question for all of you. But the question for Dr. Bond is, how did being diagnosed and transplanted as a preteen affect your mental health and your high school years? My daughter was diagnosed suddenly at 10 years old and then had a transplant 8 months later. And I think in order to talk about this question and opening it up to all of you, for those of you who didn't have the preteen to adult experience, now that we have so many more patients who are living longer and who are living from childhood to adult, how do you approach these people differently, knowing what you know? So Julie, I'll let you go first.
Yeah.
I'll let you everyone else think about the question.
Yeah, I'm glad you brought it up, because I was literally about to start typing, because it affected me so significantly. It's a journey in and out, but I have always said that the hardest part of my transplant journey was the mental health part of it. Being a 12 and a half, 13-year-old going in and out of the hospital in 7th grade. 7th graders are not nice to begin with. And it's a very important stage of self-identity and development in your normal progression, growth and development of adolescence. So I had significant weight gain from prednisone, went back to school, and was this very, very chipmunk face, different girl than who I left. And I got really depressed when I went back to school. It was like the most exciting thing I was looking forward to, like being a normal girl again, getting back into school, getting back into sports. And I got really depressed, and that was so hard for me. And I reached out, to my team, and I talked to a therapist. As a 13-year-old, I didn't say a whole lot. It wasn't that helpful. So I still encourage it, but it really was the support of my family and friends that I had before, like long before, that were actually not even in my school, that really got me through things. But it was not easy. And I've realized that it has affected my mental health and how I see things long-term too. That, I learned to develop this appreciation for life and realize, like, I don't worry about some of those smaller things that people, at least in junior high, get caught up in. But I still apply that of, small things. Yes, you can get very easily distracted or irritated or stressed about, but, I was always worried about my health, staying out of the hospital. I did have a shift of friends groups because of that. And it was not easy. And I definitely I still see myself as that teenage girl that struggles occasionally, which has been interesting to still have that, even, 20 years later, when I've been doing well for quite some time. But I would not, anyone who underestimates the impact of the mental health journey in transplant. I think it's easy sometimes as providers to focus on numbers and ultrasounds and functions, but the true, what I feel very passionate about, the true function is how is the family and the child functioning in life and being happy and fruitful and doing the things they want to do.
I love that entire answer from beginning to end.
It's just so hard to quantify. Like, it's hard to, Because everyone is so unique. What gets you going? What do you want to do? And how do we get you there?
Yeah. As a lifelong patient, I resonate with everything that you said because I didn't know my before, but I still feel exactly the same way as you did. And I did stop taking my medication at 19 when I went to college, and I realized how different I was. And my area of research is focused on redemption and like treatment, different types of treatment for the mental health side. And as a previous question of what's happening in the future, there are more mentorship programs. I think what helped me as an adult to get help with those issues that had already been resolved were speaking to other transplant patients who were like me. Just anyone, you automatically have a connection to them. I think like all four of us here have a connection that is on a different plane than anyone else. And so I think that is probably a major help, but it is still, those preteen years are very tough. The teen years are tough, and even the early 20s are tough. So your answer covered all bases of how I was feeling about it. So thank you for that. So Ken or Manu, want to jump in?
I mean, I can't add too much. It's easier being a boy. It's easier being older, but it absolutely still has an effect. So I think in middle school, high school, when I was a kidney patient, it was still pretty under the radar. Certainly, we even had like less treatment for chronic kidney disease than we do now. So there was actually not much to it. You just kind of watch the kidneys go downhill. Not pleasant, but pretty foreseeable. The twist, I think, is actually exactly as Julie said about my transplant, was you call it the young adulthood, emerging adulthood, and it absolutely derailed and threw off, both concrete plans and more abstractly like development and what I thought I was doing. And I have a very good friend who pointed out that it's developmentally completely incongruent to be a normal college student and to survive with an organ transplant. Those two things just don't go together. So you're gonna have to pick one or the other. I did pick taking my medicines and surviving with a transplant, but then, which good choice, do recommend. But it does throw off a lot of, okay, like, how do I get out in the world? How do I decide what I want to do? What I should be doing? How do I fit in with others? Again, by this point, whether age or gender, like there was no bullying aspect to it, but there was absolutely an isolation aspect to it, 100%, where didn't feel like other people, and I think I could say it's true that other people were not on the same page, living the same way I was because of how I had to. And also just the ramifications psychologically, with therapy and so forth. Okay, so what just happened and what does this mean? And even at 18, even at 38, I don't think you understand the concept of lifelong all that well. Certainly as a child or a teenager, I don't know what that means. That starts to sink in somewhere in there a little farther along and needs some sorting out, and it's challenging.
Mm-hmm. Yeah, I would say exactly. I mean, both Julie and Manu summarized everything so well. But that drive to be normal, or quote unquote normal, or to be like everybody else is so strong, whether you're a preteen, a 20-something, or something older than that I am now. But I think finding community, finding other people that are going through a similar experience. And so it's so great that there are online communities now that weren't around when we were coming up. Things like this conference that are accessible to people so that they can know that there are other people out there that are going through a similar kind of struggle and experiences.
Yeah, I think for me, there was a bit of bullying. There was in college specifically, and that desire to be normal is so strong. But it became easier when you had other friends or another support group that was there for you to kind of anchor you in. And so I think that this is a really fantastic question and needed to be asked. So next question, which I think is along those lines, and I think this is something that Julie and I might have to answer, but mostly Julie because it's about you guys. Is talking about, are you concerned with the challenges of having children while on immunosuppression? I worry a lot about my daughter's future, who really wants to be a mother. Especially when you are growing up, you are you told by your transplant team, hey, you can't have kids. Here's what you need to do with your body. Here's to how to safely manage your body with your medications, because they're teratogenic, and it's the whole thing. Julie, how did you manage that when you were younger?
Yeah, no, that's a great question. And I will at least start by saying I am a mom of a healthy 3-year-old. So it was went very well for me. But there are a lot of unique factors, that patient-specific factors, that of course should always be discussed with your team, of, kind of how your organ health is doing, what medications you're on. And, having that discussion is extremely important, and definitely family planning, because we definitely don't want any unplanned things. But yes, I was, I talked to actually my pediatric provider in my teens, because I was just curious about it. And I was first told, you can do it, just not now, which is very appropriate. So when I was ready for family planning, I talked to my then, at that point, transitioned to adult hepatologist, and things have been going well with my liver. Like I said, I was just on tacrolimus, which is safe during pregnancy and breastfeeding. And so I didn't have to worry about kind of weaning off of CellCept or other medications. I was considered a high-risk pregnancy, and was just monitored closely, just with a high-risk maternal fetal medicine doctors, and got frequent labs to monitor. Did have to do some tacro dose adjustments, just based on the physiology of pregnancy, but luckily for me, I didn't have any complications. There is growing literature about pregnancy outcomes for both the mom and babies in different organ transplant recipients. So that's continuing to build as we're tracking that as a community, but there are some increased risks. Specifically, I can speak for liver. The preeclampsia is a big one. And prematurity, but luckily I went full term, had no complications myself, and my daughter was healthy, and she's thriving and doing great.
That's wonderful. Me as a heart patient, I was told you cannot at all. And I went and I studied it myself. Like, I did a lot of research. Google Scholar was a really fantastic resource for me, of just searching journal articles to get that information myself. But that was when there was no one else really talking about these things. But I run 2 young adult support groups, and this is a huge question that we get. And in one of my support groups, we end up talking about it, I think, for 2 hours straight. It was just question after question. There are groups on Facebook, and I think someone else had asked in here, are there support groups for teens who have had transplants? I know that a lot of different hospitals have them, where there are official ones related to the team. Not sure for teens if anyone else is like patient-led or independent groups. Maybe you guys know of some.
John, a couple things to add on the pregnancy question, both the male side and the thoracic side. Male side, mycophenolate is, so CellCept, Myfortec, whichever preparation you're using, is teratogenic. I was fortunate and surprised that my transplant surgeon mentioned this at my evaluation, and I was 17 at the time. Definitely have realized we don't mention it to our male patients enough, if at all. So, which really leads to, for all of us, all organs, but especially for the heart side, heart physiology is also different. So and this applies to many forms of heart disease in young people, transplant or not. I think, as Julie said, we don't want surprises. So a year's notice is nice from our perspective, is what I tell our patients. For the cardiac patients, probably a cath in there. There can absolutely be situations physiologically where carrying a pregnancy will not be tolerated. So that could totally be patient to patient, even with the exact same organ, the exact same medications, things like that. So discuss that with your team. very, very, and it's not even discussed. Like they'll need some time and they'll need some information to give an answer on that. It isn't an absolute, but it is high risk on other levels. And discuss for men too. The risks are obviously in general less, but they do need probably even more preparation if life's heading that way. And only things I could add to Julie's lived experience.
My question for Ken and Manu are, did your teams discuss these issues with you? Because I've asked a number of younger patients who were, biologically male. Did your team discuss this with you? Was this brought up? And a lot of the answer usually comes up as no.
Yeah, that is something that we as physicians need to that do specialized care need to be better about, for sure, is having discussions about sexual health and reproductive health, things like that as well, at an early time point, so that we can introduce these ideas and make sure that patients and families are all on the same page. This includes things like HPV vaccine. HPV can lead to forms of cancer, and because of immunosuppression that transplant patients have, they have a difficult time clearing that virus and are at high risks of developing those kinds of cancers. And so having these discussions about these things are important, not just for reproductive health, trying to plan for having children, but lots of other aspects of general health as well.
Okay. So we've had a number of questions about immunosuppression, and there's a lot of them, but I'm going to try to get it in a way that we can answer a whole lot of people's questions. So someone early on asked about the different risks that immunosuppressants bring to your life, the different side effects, what it's like to live on immunosuppressants, because they, as caregivers, do not understand this. And trying to work with the patient, you want to be able to empathize and care. And so in discussing those risks and everything, what do you see, what are you hopeful for in terms of the future of immunosuppressants? So taking those risks and everything, is it the future going to head towards getting us off of those? There are different studies that are happening. So someone writes here that liver transplant recipients, some of them have been able to come off. I think I had heard at one of the universities I was at, a kidney patient was completely off of medication. Are there any possibilities of this happening with other organs, or lowering of immunosuppression happening in the future? Any research that you've heard of? And then alongside your experiences of living with it.
I'll start because I kind of mentioned this a little bit earlier, that there are I think, as Brandy mentioned, some smaller studies in liver transplant specifically, but this definitely gets to, thinking, will it go to other organs at all? It's so very specific. And I've definitely seen, as a provider, going from the patient to provider side, of a little bit how naive I think I was as a patient of how different the organs are. And while there are similarities, just how uniquely different they are, both, approaches and studies and medications, and kind of what routine medications are in different organ systems, what organs are even able to get down to one immunosuppressant, because some kidneys, Ken's nodding, often need two more so than other organs. So it's a hard question to answer, and especially how different each patient is. I think it's something, there are a number of experts across the nation that are continuing to work on this, because we do know it's always a balance of protecting the organ, but protecting the long-term health and minimizing immunosuppression side effects. Or minimizing medications and side effects. So it is something that is ongoing, and in different aspects as well.
the kidneys and hearts are both a lot less forgiving than livers. I think that's pretty established science, that there is an actual proportion, like a measurable proportion of liver transplant recipients who can get off immunosuppression. There is not for kidney or heart. There's anecdotes at best, and there's, for everyone who I know is doing okay, being very poorly compliant, there's about 10 more who are coming up for retransplant in that situation. So again, as Julie said, there is difference between organs on the biological side as to why that's true. The drugs do have side effects. I do notice, and there's a handful, certainly the big picture ones, we discussed in our transplant talks of, opportunistic infections, malignancies. There are annoying ones. The neuropathic tingling in the hands with tacrolimus. I developed a migraine disorder after starting it. It's like the GI effects of cell set, and we talk about this a fair bit in our groups. It's absolutely something to tie to sort of this theme of crossing sides that I have a little bit more of a nose for them with our patients than my partners and colleagues who do. Say, oh no, that's probably the tacro. Like, oh yeah, you're probably right. I didn't think of that. So there are absolutely, just the minor, but definitely noticeable with every dose, more guaranteed drug-related side effects that we notice. I have found sort of anecdotally that when doses are changing, I actually feel them more than even if it's a stable high dose. The treatment regimen back when I had my transplant was at levels that would be considered insane today. Didn't use induction immunosuppression, so we maintained all the medications at much higher doses. So I've certainly come down, but probably not as low as someone being transplanted today. And I don't remember the higher doses being that bad, but I definitely remember like being on a steroid wean, for instance, being a really unpleasant experience, as much as staying on high dose steroids.
Yeah, definitely. As a field, transplant is working towards that, as Manu mentioned earlier, that personalized approach and finding that right balance for everyone between infection and rejection. Having gone through that experience myself, having infections and having to go down, they took me off of most of my immunosuppression and had me on very, very minimal dose. Things seemed like they were okay for a while, but eventually that did open the door. And so for that reason, we oftentimes are a little hesitant to rock the boat, and if it ain't broke, don't fix it kind of approach. That said, that's not to minimize the impacts of the side effects, the real impact, the real like significant and serious side effects of the increased infection risks, the side effects that Manu mentioned. Of course, since the pediatric population of transplant recipients is smaller, we often have to wait for things to kind of be figured out in adults and trickle down to us. And also because our immune suppression is actually quite good in the shorter terms, in the couple of years time range. We've all seen that we run into issues oftentimes like 5-10 years out. And to be able to design studies to be able to look at those differences is difficult and takes time. And that's part of what that delay is. I know it's frustrating, and I of course want us to be able to come off of immunosuppression, but it's going to take. We're moving in that direction, but it's going to take time.
Yes, I think that people are asking about the Amy Silverstein New York Times article that discussed the frustrations with immunosuppression and what it does, not even just in terms of risk factors, but how it cascades into something larger. The cancer that we get, especially if you're pediatric to adult, someone like me who's 30 years out, getting PTLD out of absolutely nowhere and being told you will get it again after retransplant. Do you accept this? If not, we won't give you an organ. It's those things that you get told that you have to accept. Would any of you like to comment on that article and how you resonated with it?
Both the article and the video she did for CBS Sunday Morning were really impactful, and I think did a really great job at drawing attention to this issue and to a much broader audience than normally would be thinking about it. And I 100% agree, as we discussed before, there need to be innovations and changes to move their field forward. That said, for me personally, it was always framed to me that transplant is a treatment and not a cure. And although I've had to deal with these ups and downs with infections, rejection, thankfully not cancer yet, knock on wood. the trade-off of otherwise having to be on dialysis and or not being alive now. I think I'm grateful for the opportunities that I have, even with these long-term complications that come. But that's me personally.
Yeah, my twin thoughts on Amy Silverstein's article and video. I think one is exactly with Ken's, that raising awareness, raising a call of things we can do better is completely welcome, and it exists. She did sort of take a tack that there hasn't been enough innovation. I just saw that differently, that it seems that a lot of the innovation we've had is towards increasing the bounds and the accessibility of transplant. That, okay, we've expanded kidneys into donation after cardiac death. We've expanded into hepatitis C positive transplants. That these I don't think there's anyone who could suggest that these improve the long-term outcome in any way. They may even hurt it, but they're at the benefit of making transplant accessible to more people. That, yeah, and when kidney transplant started, you had to be under 45 and not diabetic. Kids could not get transplants in the early era of transplants. They were too high risk. I know, and maybe a little more in my current center than others, but overall in our field, we've pushed the boundaries of who can get a transplant, how we can get donor organs. A lot of the innovations have been in that direction. There's probably motives to that are less long-term beneficial. Centers want to do transplants, and we like doing them, and we want to offer it more. I hope it hasn't been at the expense of knowing that we're playing for a lifetime, especially as people treating children, and we need to be doing the best we can to improve those 20, 30, 60-year outcomes. But we have had innovations, maybe more ones that she didn't fully acknowledge, and they have been in the area of making transplant more broadly accessible, getting us to over 1 million transplants that wouldn't have happened without the innovation that we've had now. I think there's even more work to do in that direction. There are people who die waiting for a transplant. We want that to not happen. And going back to the beginning, it's 100% fair to throw down the challenge that we need to improve long-term outcomes. I don't think anyone could possibly disagree with that or making us aware of that. Mm-hmm.
I think it also speaks to different generations differently. So I know caregivers who did not like the article because it painted the picture in a certain way, but on my social media with all the young adults being from 18 to 45 range, it was celebrated. And getting honest with these topics of the kind of darker side of living with transplant is something that I think is a generational difference as well. But I also think it speaks to the film that kind of is almost invisible between patient and provider, where Manu, it's like what you were saying, that there have been so many more innovations where certain issues arise and there are exact pinpointed treatments that maybe we advanced with that patients don't necessarily realize we advanced so much to. So I think it's an interesting discussion. So we're going over a little bit with our time. It's 11:20 now. Does anyone have any more comments to make regarding that last question? Okay. If you have a Twitter, would you like to drop it in the chat so that our audience can maybe check out what you're doing, hearing some interesting things you have to say on Med Twitter?
I
Only
think
if you'd
those
like
are on
to.
our bios, but I'm glad to drop it as well.
Okay. And thank you all so much for coming. Are there any last remarks that you'd like to make, last pieces of advice that you'd like to leave everyone with?
I just wanted to say thank you everyone for attending. It was an honor to be a part of this. I hope, our discussions are helpful, and there's always more questions, and, just always remembering there is a community of support out there. I think that the transplant community is a powerful one that definitely, I think, has helped all of us get to where we are and continues to inspire us. So sometimes when there's hard days or times, having events or get-togethers with your transplant friends, community, it definitely kind of sparks an enthusiasm. So I just wanted to say thank you, and keep enjoying life, the life that we have to live.
This is Joseph Hilleberg. I'm a transplant dad and part of the transplant families team. I wanted to thank the panelists for giving your time today. I think you're all an inspiration to our kids. And my son's 11. I don't know what field he's going to go into, but I've seen through my advocacy work, I've seen a number of recipients go into medicine, like Silke Niederhaus, Kim Mussolini at UNOS, and some others. And I think that when you have that intersection between patient and provider, it really kind of increases the level of passion that you put into what you're doing, because it's personal to you. And I think that really, like, I don't know if it changes the quality of the work you do, but certainly it makes, I think it's definitely more inspirational. So I appreciate, thank you for all of your hard work and for your time today.
To close out, I'd also like to also add from my perspective, we spent a lot of time talking about complications and difficulty, but there's so much joy that comes with being a transplant recipient. And as provider, as patients, as family members and caretakers, you're so much stronger than you may think you are. And I think, as Julie mentioned, the community that we are able to have with this special connection is really something special. So I really want to give a plug for the transplant games, transplant camps, things like that, where you and your kids can meet other people like you. And Manu, if you have any last thoughts as well.
Yeah. I think my last words are also optimistic notes. First, I do think, sort of developing off what Gianna said, we have gotten better at involving patients. I think when those 10 years post-transplant pre-medical school did not have the same avenues to get involved. We have patient representation in all of our research collaboratives across the pediatric organs, PHTS for heart, Social Network for liver, IROC for kidney. The professional societies, all that involvement has gotten a lot better. The transplant community has always been very strong. I've met a lot of the same people in various settings, and they've been a totally separate source of support beyond my own family, my own friends, colleagues that are in the more proximate world. I don't want to say real world. And finally, I do think we are getting better. We're getting better as a transplant community, and having this community and this being able to be involved for my job and as a physician as well has added a meaning to it that I don't think I'd be able to find otherwise.
Very well said. I think for me, I grew up in transplant, and I wrote in my application essay, 50% of my life was already dedicated to transplant, and I'd like to dedicate the rest of the 50%. And I think that we need that in the future of pediatric patients growing up and getting involved in whatever sector it might be. If you want to be a doctor, but there are so many other ways to change this community. And I think we are on like the cusp of like a patient advocacy revolution right now in terms of transplant, and the people who are starting groups now. And those groups will eventually become standard practice in every single hospital. It will become standard care to be attentive to mental health, to have support groups. That is like what I've dedicated my life to doing. I draw comics about transplant, and I'm like, can we draw comics explaining a biopsy? Can we do these things? And that affects mental health. It was something that Julie had mentioned. It all comes together. And so I think that no matter what you are doing as a caregiver, you still make an impact in this very growing, very pretty incredible revolutionary community. So I think thank you all for being here.